Today I would like to talk about stroke or paralysis attack. So when stroke strikes your family or the dear ones, you need to respond quickly. First of all, you need to be able to identify the symptoms of stroke when affects your family members. You should be able to identify the person who is having a stroke. This is called a fast campaign. F for face, which is the weakness of the face. A is arm, are they able to raise the arm? S is speech, any problem with the speech. And T is the time, which is the most important thing, where you have to call the ambulance and bring the patient to the emergency department. After bringing to the hospital, after a brief assessment of the patient, we do a scan of the brain to identify the cause of the stroke, which is either caused by a bleed or a clot. Once the clot is confirmed, we give a very strong clot dissolving injection, which is called thrombolysis. The most important thing with this injection is it has to be given within a duration of 4.5 hours. The quicker we give is the more impact. Remember, time is brain. The longer the delay, the more brain is damaged, and the patient is left with more deficit or more disabled. In some of the circumstances or certain cases, when the clot is very big and which may not be dissolved by clot bursting medications or by thrombolysis, then we have to remove the clot mechanically, which is called mechanical thrombectomy, where simply we put a wire into the artery and pull the clot out. Remember, this is how you can identify a person who is having stroke. F for face, A for arm, S for speech, and T is time, which is the golden time to bring the patient into the hospital, which is less than 4.5 hours. But quicker the better. And remember, the time is brain, because quicker the thrombolysis is given, the more amount of brain is saved and the patient is less disabled. Thank you.